Hey there! If you're looking for some clear, no-nonsense information about anal warts, you have come to the right place. Our goal today is simple: walk through the essentials, answer your questions, and hopefully ease any concerns you might have. All the info we're covering is based on the ASCRS textbook of colon and rectal surgery. So let's just dive right in.
Here's a quick look at what we're going to cover. First, we'll tackle what anal warts actually are. Then, we'll get into how they're diagnosed and what your treatment options look like. After that, we'll talk prevention and what to expect down the road. It's a simple roadmap to get you up to speed.
All right, first up, what are anal warts? We're going to break this down into simple, easy-to-understand terms. No confusing medical jargon.
So what are we really talking about here? Let's get right to it.
Okay, so the fancy medical term is Condyloma Acuminata. But what does that mean? Basically, they're these fleshy growths that sometimes get described as looking like tiny bits of cauliflower. Now here's the most important part. They're caused by the human papillomavirus, you've probably heard of it as HPV, and they are non-cancerous. They're benign.
Let's get into a few key facts. These warts are usually caused by very specific types of HPV, numbers 6 and 11. They're passed through sexual contact, and it often takes about 3 months after you're exposed for them to show up. A lot of people don't have any symptoms at all, but for others, there might be some itching, bleeding, or just general discomfort. And here's something really important to know. While condoms definitely lower the risk, they don't get rid of it completely, just because the virus can be on skin that a condom doesn't cover.
And you know, to put all this in perspective, it's so important to realize that the virus behind all this, HPV, is incredibly common. We're talking over 20 million people in the US alone. So this isn't some rare thing at all. It's a very common health topic, and just knowing that can really help reduce any stigma or worry. You're definitely not alone in this.
Okay, that brings us to our next section. How does a doctor actually diagnose them? Let's walk through what you can expect if you go in for a visit.
The whole process is usually really straightforward. It pretty much always starts with a simple visual exam. The doctor just takes a look at the area. The next step might be something called an anoscopy, and we'll talk about that in just a second. And sometimes, only if it's really needed, there's a third step, a biopsy. That's usually just if things are a little unclear or if warts aren't responding to treatment.
So, this anoscopy, what is it and why would you need one? Well, it sounds a little intimidating, but it's a really simple procedure. A small instrument is used to get a clear look just inside the anal canal. And the whole reason for doing it is to see if any warts are hiding inside. Knowing the full picture is absolutely crucial for your doctor to create the best, most effective treatment plan just for you.
Okay, let's move on to treatment. Once you have a diagnosis, what can be done? The great news is there are a ton of effective options, and the whole goal is to find the one that is the perfect fit for your situation.
This quote really nails the goal of any treatment. It's all about one thing: getting rid of every single visible wart while being as gentle as possible to all the healthy skin around it. It's about being effective, but also being safe.
Generally, treatments fall into 3 main buckets. First, you've got stuff you can do yourself at home, like special creams for any external warts. Second are the treatments your doctor does in the office, things like freezing the warts or applying a specific kind of acid. And the third bucket is surgery, which means physically removing the warts. That's usually for bigger ones or any that are internal. Your doctor will help you figure out which path makes the most sense.
All right, so after treatment, what's next? Let's talk about the future, what to expect, and the single most powerful tool we have for prevention.
This is a really important point to understand. The goal of treatment is to clear away all the warts you can see. But, and this is a big but, the treatments remove the growths. They don't get rid of the underlying HPV virus from your body. The virus can kind of hang out, dormant, in your system.
So, because that virus can stick around, there's a chance the warts can come back. But let's look at the actual numbers because they're pretty encouraging. The recurrence rate is somewhere between 4 and 29%. That means the vast majority of people, we're talking over 70%, do not have the warts come back after a successful treatment. So yeah, it's a possibility, but the odds are definitely in your favor.
So what's the best way to stop this from happening in the first place? Well, the science on this is crystal clear. The single best, most effective strategy we have against HPV and everything it causes, including anal warts, is the HPV vaccine. The vaccine we have now, Gardasil 9, is a real game changer. It protects against the main HPV types that cause most warts and most HPV-related cancers. It's recommended for boys and girls, usually starting around age 9, but, and this is great, it's also been approved for guys all the way up to age 45.
That makes it an amazing preventive tool for so many people. Okay, for our last section, we just need to quickly touch on a related condition that is very rare, but it's important to know about. Just keep in mind, this is not what we typically see.
The condition is called giant condyloma acuminata, or GCA. And just like the name says, these are much, much larger and more aggressive warts that can really grow and spread into the tissue around them. But again, I have to stress, this is a rare variant and it's very different from common anal warts.
The reason doctors treat GCA so differently is because it carries a risk of turning into a type of skin cancer. Because of that risk, the standard approach is much more aggressive, usually a wide surgical removal to get the entire lesion out and make sure the edges are clear.
So, let's wrap it all up. What are the key things to take away from all this? Number 1, anal warts are common, and they're caused by HPV. Number 2, there are plenty of really effective treatments out there. Number 3, remember, treatment clears the warts you see, but not the virus itself. And finally, number 4, the HPV vaccine is, without a doubt, your best line of defense. And we'll leave you with a question to think about. Knowing all this makes you an active partner in your own health. So based on what you've learned today, what's one question that's popped into your head that you can ask your doctor next time you see them? Thank you so much for joining us.